Welcome back to You Heard It Here with Dr. Gary. I'm Gary, one of the clinical audiologists and part of the ownership team here with Advanced Hearing Group in Scottsdale, Arizona. Today, we're going to chat about otitis media, or middle ear infections. Before we start, here's my disclaimer. This is not medical advice. If I haven't seen you in my clinic or you haven't seen one of my audiologists, I'm not giving medical advice. I'm trying to provide some information about otitis media or middle ear infections. Please don't misconstrue this as medical advice. If you're suffering from a suspected ear infection, please visit your primary care doctor, your otolaryngologist, your ENT, and or your audiologist for additional help. All right, with all that being said, what is otitis media? Otitis media is an infection in the middle ear space. Your middle ear extends from the backside of the eardrum to the cochlea. It's supposed to be an air-filled space that contains the three bones of your middle ear. Those three bones are your malleus, incus, and stapes bone. It also contains your eustachian tube. Your eustachian tube is basically a pressure valve that allows for pressure and or fluid in the middle ear to go through the tube and into the back of the nasal pharynx, allowing you to equalize pressure between the ear canal, or the outer ear, and the middle ear space. So if your eustachian tube is not opening properly, fluid can build up in that middle ear space and you can have an infection there. This is not the same as swimmer's ear. That's an infection of the outer ear. This is actually in the middle ear space. This middle ear infection is much more common in young children than in adults. However, as you can see up here, there's a lot of adults who do get middle ear infections. What made me want to talk about this today was a patient came in suffering from aural fullness, pain, and reduced hearing, and they were convinced that they were packed with earwax. So when we started to do the removal, you could see all the way down to the eardrum. You could see the discoloration of the eardrum, and you could also see that the eardrum does not appear to be moving when the patient attempts to Valsalva or equalize the pressure between their outer and middle ear. They were referred on to their primary care doctor, who diagnosed them with otitis media and put them on medication. This cleared up relatively quickly, and they're doing really well. Their hearing returned, the fullness, pain, and pressure subsided. If you are experiencing fullness, pain, or pressure in your middle ear, and it is not due to earwax, it may be due to an ear infection. Ear infections often stem from a cold or a sinus infection, where the fluid migrates into that middle ear space, becomes infected, and causes that middle ear infection. Oftentimes, you will be prescribed medication, and in some severe cases where it's recurrent, especially with young children, pressure equalization tubes, or PE tubes, will be recommended by your otolaryngologist. Understand that the point of these pressure equalization tubes is to cause a balance in pressure between the middle ear and the outer ear and prevent a rupture of the eardrum. Untreated middle ear infection can eventually cause damage to the eardrum, sometimes requiring surgery. If you are experiencing symptoms of a middle ear infection, please visit your primary care doctor, your otolaryngologist, and or your audiologist to figure out what's going on. This has been You Heard It Here with Dr. Gary. Thank you for watching. We'll see you in the next video.